Whenever we do a heart scan here, it's called a CT, cardiac calcium scoring. We're looking at the four main arteries that supply blood to your heart, and we're going to see if you have any kind of calcium buildup or calcified plaque in those arteries. During that test, we're going to look at those main arteries and we're going to see if you have any buildup in there, and if you do, then that increases your chance of having a cardiac event. A lot of times heart issues are silent killers and you don't know what's going on, you don't know that you even have a problem. Also, it's really good for this test because we don't just get the heart. You're going to get some pictures of the heart if you have that test done, but we actually send images of the entire chest in the area that we scanned. We found kidney cancers, we found stomach cancers, lung cancers, we found nodules on a lot of patients that they're then able to follow up with their physician and get other tests done to make sure that it is just a nodule. But it is nice to know that you have those things off of this very simple, quick $50 test that we offer here. One story I'd like to tell is we had a very young guy who's 53 years old. He came in and he didn't want to have the test done. His wife was actually a nurse in the cardiology building, and during the Heart Health Month, employees get 2-for-1s. So she got one for herself and one for him, and he kept putting it off and putting it off. He was a very fit guy, ate very healthy, looked very healthy, and he came in and said, well, I'm not going to have anything on this test. You know, there's not going to be any problems with me because I'm very healthy. We did the test and he had one of the highest scores I can remember. It was over 2,500. And the very next day he was actually at St. Luke's getting stents put in his heart. That's why I'm so glad that we offer this here. There's a lot of surrounding facilities that do not offer it. So we're very fortunate to be able to do that here and provide that for our community.